Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me start by apologizing truly for this late start of the broadcast. You know the season and the times in which our nation is in now. So there are many contending issues. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for today, Monday, 26 October 2020. The Presidential Task Force could not hold the briefing for Thursday last week due to the security and other pressing national issues. Today, you will also observe that most of the ministers are not present because they are out of station for community and stakeholder engagements. Over the past 2 weeks, Nigerians have focused attention on two important issues, namely, one, the protests by youth, which has unfortunately metamorphosed into an unprecedented safety and security situation, and two, COVID-19 developments in country and around the world. Both activities are critical to our nation because, one, the security situation impacts negatively on our economy, social life, international reputation, and ability to effectively coordinate the national response. And two, the large gatherings witnessed during the protest and during the break-ins at various warehouses, homes, and the looting of stores put us at a great risk of resurgence of the virus. The global pandemic situation has continued to escalate. The cumulative number of infections has crossed the 43 million mark. The United States of America, Europe, and India continue to post high numbers due to the resurgence in those countries. The global fatality count has also reached a cumulative number of 1,158,810 COVID-19 cases, and the case fatality ratio has, however, declined gradually to 2.7%. It is important to note that in the last 24 hours, 4,498 deaths were reported from 96 countries and territories worldwide, with Europe, France, that's countries listed in Europe, France, Italy, and UK, accounting for 30%, which is equivalent to 1,358 deaths. The African continent has recorded a cumulative total case count of 1,727,887, including 41,323 deaths, with a case fatality ratio of 2.4%. Nigeria continues to maintain the 5th position in highest cumulative cases after South Africa, Morocco, Egypt, and Ethiopia. You will recall that when the PTF reopened the airspace, you were informed that discussions were ongoing with EU ambassadors on the resumption of flights by European airlines. I'm pleased to inform you that there have been positive developments which the National Coordinator shall elaborate on during this briefing. At the last national briefing held on Monday, 19th October 2020, the Presidential Task Force appealed to the youths of our nation to embrace the offer of dialogue and leave the streets so that government could address their concerns in a sustainable manner. In the intervening period, His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria, also addressed the nation and assured that their voices have been heard loud and clear and that government was responding. Unfortunately, the protests have been hijacked by other tendencies that have inflicted great economic costs through arson, looting of warehouses, invasion of private homes, shopping malls, jailbreaks, and generally engaging in wanton destruction under the disguise of the protests. Of particular concern to the Presidential Task Force is the issue of palliatives found and looted from various warehouses around the country. It is important to make the following clarifications. The federal government palliatives consisted largely of the 70,000 metric tons of grains released from the strategic grain reserve, as well as rice cured from the Nigerian Customs Services, as well as other palliatives that were given to states that either experienced flood or some form of disaster. The share for each state were released to the state governments for onward distribution to the citizens. The private sector coalition, COVID, that had been quite supportive of the federal government, worked with states through the Nigerian Governors Forum to determine the quantum of their interventions, which was intended to be effective and equitable. A number of indices were worked out for this purpose. The national coordinator, again, shall also provide further distinction and the modus operandi for the distribution of the palliatives donated to the states by the coalition. The Presidential Task Force still wishes to appeal to all Nigerians to remain law-abiding and collaborate with law enforcement agencies to restore normalcy to our dear country. Humanity has been traumatized by COVID-19 in the year 2020. Our nation is not experiencing a second wave, but has been impacted negatively by the looting and arson. I will now invite the Honorable Minister of State Health, followed by the DG, Nigerian Center for Disease Control, and then the National Coordinator to update you on developments before we take your questions. Once more again, our sincere apologies for starting late. But however, I continue to thank you for
the Chairman of PTF, my colleagues in the task force, media representatives here present, distinguished ladies and gentlemen. As of today, we have recorded a total of 61,992 confirmed cases from 607,435 persons tested for COVID-19, while 57,465 cases have been discharged. We have sadly lost 1,130 persons to the disease. We now have 3,397 active cases as more persons are treated and discharged, with a case fatality rate of 1.8%. This is less than the case fatality rate of 2.4% in Africa and global rate of 2.8%. We are not relenting in our efforts to ensure that the case fatality rate continues to decline as we focus on improvement in case management capacity and ensure availability of equipment and medical consumables for our health workers. With a decline in the number of active cases and the number of cases on admission dropping, some isolation centers in the country are already making arrangements to rationalize the number of frontline health personnel into the reserve pool or redeployed. This will be done in a manner that will allow easy remobilization where necessary. We, however, have advised states and relevant stakeholders not to completely close all isolation centers due to consistent lack of patients, but some centers should rather be maintained. This is to ensure promptness and readiness against any surge as part of preparation against possible second wave. We are taking advantage of these low active cases to carry out appraisal and reappraisal of activities at the isolation centers. This is necessary to assess and understand areas of strength, weaknesses, available opportunities, as well as dangers. Such activities will consolidate gains while taking measures to prevent reoccurrence of errors as well as deployment of appropriate resources. We are also making arrangements for stock taking and repurposing of equipment earlier deployed to temporary isolation centers with a view to using the opportunity provided by the resource mobilization for COVID-19 response for health systems strengthening. We shall again use this opportunity to appeal to our youth to stop crashing our medical stores. Most of the medicines and medical consumables in these stores are stored under controlled environmental conditions, such as temperatures and humidity. Disruption of these conditions will render them ineffective and, in some cases, poisonous. The NCDC warehouse in Edu is used for the storage of medical and laboratory consumables and equipment. Destruction of these items will impact negatively on our response to the present pandemic. We also call on all who are in possession of vaccines, medicines, and other equipment and consumables to please return them. Those that can still be salvaged will be used, and those that cannot will be disposed of properly. I close by advising the general public to continue to practice non-pharmaceutical interventions prescribed by infectious diseases experts, including hand washing, use of face masks, hand sanitizers, and social distancing in order to control community spread of the disease. I thank you for listening.
The Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. I know it's a bit late, so I'm going to just go rapidly through some of the issues that I wanted to raise. First of all, I want to re-echo the statement by the Honorable Minister of State Health that we are all shocked by the events of the last few days. Some of our warehouses do not contain food items. They contain medical equipment, they contain test kits, they contain valuable items that are really extremely important when it comes to the COVID response. And therefore, we are pleading with all those that are currently in the process of planning, etc., to desist from doing so. It's important that our assets are protected. It's important that what the country has bought for the purpose of the COVID pandemic and what our donors have provided are used for the purposes that they are meant to. And this purpose does not include looting of the items. So I wanted to briefly also talk about COVID. I understand there's a lot of confusion between the Presidential Task Force mandate and that of COVID. COVID is a private sector initiative which was set up in the early part of the response as contributions to government. And the PTF has worked very closely with COVID to deliver some of our key mandates. It is important to remember that as we go into the issues of palliative supply, storage, and distribution, that this process is integrated and it's also very complex. But we also understand that palliatives need to be distributed with the greatest urgency so that the millions of struggling Nigerians receive the economic support. COVID have been a critically important partner in our response to COVID-19. Not only have they supported the country in the provision of PPEs and test kits, they've also provided technical support like the development and launch of the Nigeria International Travel Portal, which has made it possible for passengers to come into the country and to depart on international routes. COVID has also been working with state governors, the FCT, and the Nigeria Governors Forum to procure, deliver, and distribute palliatives to 1.7 million Nigerians, the most vulnerable households across Nigeria. What I'm going to read out now are the facts. Food items were meant to be delivered to 1.7 million families across all 774 local government areas in 36 states and the FCT. It is an unprecedented relief effort, which actually started early on in April. The sheer scale of the food program by COVID meant that the program had to be delivered in a staggered and controlled manner. COVID worked with the states through the Nigeria Governors Forum to determine the number of households that will have these reliefs, to enable states and the FCT to provide clean and secure warehousing for the food. Only the Lagos warehouse is private property. The rest of the warehouses used have been state warehouses. It also included the adoption of COVID guidelines on how the food will be delivered, which involved state and local government committees, chairpersons, religious organizations, etc., to ensure equitable distribution of the food among the needy. Out of the 11.7 million supplies ordered, 11 million were confirmed to have been delivered. And in terms of the schedule, 17 states had 100% delivery and a kick-off exercise was conducted. 12 states had over 85% of deliveries reached. Only 8 states did not have a flag-off or formal handover of these commodities. Of the 8 states, 2 had 100% of deliveries reached, and a process for the kick-off exercise is currently in place, whereas the remaining 6 states had 68% of deliveries reached. Since the relief effort began with COVID and the state governments, in early August, official flagging of and handover of the palliatives have taken place in 28 states and the FCT. And these states have been distributing food at various paces based on need. It's also important to clarify that some of these state governments have actually bought their own palliatives that they are distributing. Some states have received near complete or complete deliveries of the food items allotted to them. As of October 25th today, several states have confirmed the completion of their distribution. It is therefore quite concerning that we continue to see images of looting on the social media, given all the work that has been going on and the goodwill of the private sector towards supporting the COVID response. We do understand, of course, the underlying issues, but we continue to ask and we continue to plead with the general public to exercise restraint and allow this process to conclude. At the PTF, we will remain focused in dealing with the pandemic. This is our mandate, and we will not be distracted. And we plead with the public to please continue to work with us, as well as our private sector partners and the state governments, so that we can get on top of what is clearly a major issue, not only nationally, but globally, and that continues to challenge governments across the world. Thank you.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, my colleague of the press, good evening. You might have noticed that in the last week, we paused on some of our social media activities, especially the daily sharing of numbers every evening. We did this as a sign of respect to those who have lost their lives and who have otherwise been affected by the very painful events in our country. While the public health response is important to COVID-19, it's also important that we are sensitive to the climate and going-ons in our country. But it's always important to remember the context. I lead an organization of which 65% of all the staff in NCDC are under 35. So most members of my team are directly affected, feel the same emotions that many other young people feel and have felt across the country over the past few weeks. But it is these same young people that I have to motivate every day to keep going to work, to keep testing, to keep traveling across our country, distributing commodities, ensuring that since the beginning of this outbreak, there hasn't been a single stock out of lab reagents, of PPEs anywhere, any significant stock out that we've been informed of. We have sustained our efforts because of the work these young Nigerians do. They work for us collectively, literally collectively. They work every day, Saturday, Sunday, mornings, afternoons, evenings. One of them, a couple of weeks ago, we lost a member of our staff at NCDC because he had traveled to one of the states in Nigeria, and on his way back, unfortunately, ran into an incident that cost him his life. It is these same young people that we need to keep working for us collectively. It is because of them, with them, because of all of us, that we have to sustain this response. So we must not let our anger switch into a situation where we head into a double jeopardy. The outbreak is escalating around the world, literally. We have held things down because of our proactive measures, the very effective airport screening processes that we've put in place to limit the reintroduction of cases from countries where the outbreak is escalating. But this virus does not know whether the reasons why people are congregating, whether you're congregating for religious purposes, for protests, for partying, whatever it is, this virus takes opportunity of people coming together. So over the last few days, you would have seen very low numbers. Those low numbers reflect the fact that in many states we have not been able to test as much as we would like to because there have been curfews. Most of our testing, 60%, 40 to 60% of cases in Nigeria are reported from Lagos. Our labs in Lagos have not been able to perform as they normally would for the past 2 to 3 weeks, literally. So we must keep at it, like the national coordinator has said. We can't afford to let down our guards, irrespective of what our anger is at the moment. So as we move into the next 2 weeks, it doesn't take a rocket scientist to know that we have to watch the numbers very carefully. The reasons are obvious. We have gathered in our masses for whatever reason, and now we have to kind of keep our eyes open to face the potential consequences. But those consequences are not inevitable. We can still do our part to prevent them. There are over 1,000 known deaths that would not have happened in Nigeria this year without this virus that have happened. There could have been a lot more, if not for the proactive work we have done collectively as a country. We cannot let down our guard. We cannot afford to add this to the many challenges we already have. The many states in Nigeria have done extremely well in the last few weeks, raising their testing capacity across the country. So we must stay on the ball. I know there's a lot of despondency across the country, and you can feel the mood wherever you go, whether it's in this room or outside. But somehow, knowing the opponent that we face, we have to get up the next morning and find the energy to keep working hard together and ensuring that we do not lose the very fragile gains that we have worked so hard to achieve for the last 8 months. So these are my few comments today. I encourage all of us to just try hard to keep our eyes on this ball while we try and sort out the other obvious challenges that we face collectively as a country. Thank you very much.
Health officers that will help with enforcing the protocol and guidelines of the containment of the virus. And I'm happy to report back to you today that the report that has been coming to us from our desks in each of these schools, everything seems to be going very well. People are adhering to the protocols. We have no any incidents of seriously reportable spread of the infection. And we thank the people and still call that you continue diligently with maintaining the protocols. As the chairman has mentioned, the disease is still out there. Other countries are locking down. Other countries are facing a lot of resurgence. We should not let up on the effort. We should continue because we do not want to see a resurgence here in Nigeria. Quite already, the numbers are going down, but it's simply because of our adherence to these protocols. So anything to not do so will give the reverse effect, and we do not want that. Jama'a assalamu alaikum. Zan ɗan yi bayani takaitacce.
My name is Amaka Ude. I report for Arise News. My question is just for Dr. Sani. The chairman in his speech had said that you were going to give us an update with regards to the EU and the negotiations that were going on. So we need that from you. Thank you.
Members of the PTF here present, I want to thank everybody here today for today's session, and also lend my apologies, as the chairman has said, for our late starting today. Today is not a day for long speeches, and my simple advice to the youths is that with the recent happening in the country, it really poses some level of danger to our national response to this pandemic. So it is on that note that I advise the youths to desist from destroying our national assets, especially with respect to its effect on our drive to end this pandemic. So you are advised, we are pleading that you take caution and embrace peace, as the government has offered that olive branch to you. So on that note, I want to thank everybody for coming today, and we have to wait until our next edition on Thursday is by Monday next week. We hope to see everybody here. I want to thank